All right, let's dive into one of the most baffling conditions in all of medicine, chronic regional pain syndrome, or CRPS. Seriously, this thing is a genuine medical mystery, and it makes us question everything we think we know about pain.
I mean, think about it. It all boils down to this one question. How can something simple, like a sprained ankle or a small cut, spiral into this overwhelming, unending agony? It just doesn't seem to make sense. And that's the paradox that sits right at the heart of CRPS.
So here's our game plan. We're going to start with what CRPS actually is and look at its two different types. Then we'll get into why the body freaks out like this, how to spot the signs, how doctors actually diagnose it, and finally, what can be done to manage it.
Okay, first things first. Let's really nail down what we're talking about when we say CRPS.
You know, the name itself kind of gives you the whole story. It's chronic, which means it's in it for the long haul. Regional, because it typically camps out in one limb. Pain is obviously the main event, but it's a level of pain that is just completely off the charts compared to the initial injury. And syndrome is the key. It's not one symptom, it's a whole collection of things happening all at once.
Now here's where it gets a little more specific. We talk about CRPS like it's one thing, but it actually shows up in two different flavors, and telling them apart is super important. The big difference between type 1 and type 2, it all comes down to the nerves. With type 1, which some people might know as RSD, there's no obvious confirmed nerve injury. The pain is just there. But with type 2, doctors can point to a specific nerve that's been damaged. So that's the million-dollar question. Is there a smoking gun, a clear nerve injury, or not?
So what in the world is going on here? Why does the body react so dramatically? Well, it turns out it's not really about the injury itself. It's about the body's response system going completely haywire.
This is probably the best analogy I've ever heard for it. The trigger, that falling leaf, is tiny insignificant. But the system, the car alarm, goes absolutely nuts. And the real problem? You can't find the off switch. The body's pain and inflammation response is just stuck on full blast.
It's basically a three-step meltdown. First, that initial injury kicks off a bizarre, over-the-top inflammatory reaction that messes with the autonomic system. You know, the automatic stuff you don't think about, like sweating and blood flow. Then, the real kicker, the central nervous system itself starts to change. The brain and spinal cord literally rewire themselves to become hypersensitive, turning the volume up on pain signals to an 11.
With all that internal chaos, what does it actually look like from the outside? What are the telltale signs a doctor is searching for?
There are four main signs that scream CRPS. Number one is that constant, brutal pain. Patients often say it feels like their limb is on fire. Number two is swelling in that area. 3, you get this incredible stiffness and loss of motion. And finally, number 4, you see these weird changes in the skin. It might turn red or blue or super pale and feel burning hot or ice cold.
And when you look at a map like this, wow, you can really see what doctors are up against. It's not just a straight line from cause to effect. It's this complex, tangled web of symptoms and biological pathways that all have to be considered.
On top of that, the condition isn't static. It changes over time, especially if it's not caught early. In the first few months, the limb might be hot and red, but later on, as the pain gets worse, the skin can get cool and dry. And if it becomes chronic, the limb can get cold and pale, with a real risk of permanent changes, like tissue damage.
Okay, so with all these shifting symptoms, how on earth do doctors land on a definite diagnosis? Well, as you can probably guess, there's no simple blood test or scan. It's more like detective work, a process of careful observation and ruling things out.
To make it official, doctors use something called the Budapest criteria. It's essentially a 4-point checklist. First, the patient has to have that ongoing, disproportionate pain. Second, they have to report at least one weird symptom, like strange skin color changes. Third, the doctor has to actually see a sign in at least 2 of those categories. And fourth, and this one is crucial, there can't be any other diagnosis that explains what's happening. And while that checklist is the main event, other tests can help back up the diagnosis. Things like X-rays might show some bone thinning, a bone scan can show changes in blood flow, and thermography can actually measure the temperature difference between the 2 limbs. It all adds to the pile of evidence.
Getting a diagnosis like CRPS can sound terrifying for sure, but it is absolutely not the end of the story. There is a path forward, and it's all about taking a very proactive and well-rounded approach to treatment.
And you know what? That path can even start with prevention.
Get this. Some studies show that taking high doses of vitamin C right after something like a wrist fracture can actually lower your risk of getting CRPS type 1 in the first place. How cool is that?
But for someone who already has it, there's no single magic pill. It's a full-on strategic assault. Physical therapy is always the foundation, especially incredible techniques like mirror box therapy. This is where they use a mirror to trick the brain into seeing the painful limb moving normally. It's a way to hack that brain rewiring we talked about. Then you've got medications, nerve stimulation to scramble the pain signals, and nerve blocks to calm everything down.
Let's talk about those nerve blocks for a second. They're super targeted. The goal is to inject anesthetic right next to the overactive sympathetic nerves. So if the pain's in your arm, they'll do what's called a stellate ganglion block in your neck. If it's in your leg, they'll do a lumbar sympathetic block in your lower back. It's all about going right to the source.
When you step back and look at the whole picture, CRPS is so much more than a diagnosis. It teaches us something really profound, that pain isn't just a simple message sent from an injury to our brain. It's a complex reality that our entire nervous system builds. It really makes you wonder about that powerful and frankly mysterious connection between our minds, our nerves, and how we experience the world.